what I have been taking up in mnemonics. So this video I'll be mainly focusing on the one of the very in professional exams when you are supposed to write about the causes of sinus tachycardia. So this video I'll be mainly dealing with the causes of sinus tachycardia, and in professional exams and as well as in viva voce when you are supposed to write and ask, when the examiners ask you about the sinus tachycardia, so it becomes very difficult and cumbersome to enumerate in sequence as to what is the cause for sinus tachycardia. So in this video, I'll be discussing about the easy mnemonics as to how we can very easily memorize and pen down in sequence and tell the examiners in the viva voce what are the causes of sinus tachycardia, particularly after heart surgery. So this thing I would like to emphasize, that after heart surgery, what are the causes of sinus tachycardia, what we ought to remember for the exams. So viewers and students, just one line definition. What is the difference between tachycardia and sinus tachycardia? So within a simple terms, I would like to say that tachycardia is the condition when the heart beats faster. So basically when the normal heart rate is between from around 60 to 100 beats per minute. So this is the normal heart rate. But when the heart beats faster than normal, so this situation, this condition is called as tachycardia. But in the condition of sinus tachycardia, it's actually in the heart, you must have seen that there are four chambers, and the sign where the electrical impulses begin. So that point from where the impulses of the electrical stimulus or the electrical signals begin, so that point is called as the sinoatrial node. So actually after a heart surgery, if a tachycardia is occurring, so it is that tachycardia is basically due to excessive stimulation. The atrial node, that is the sinoatrial node, is sending impulses, is firing electrical impulses at a faster rate. So that condition, it is called as sinus tachycardia. So in sinus tachycardia, you ought to remember that it is the sinoatrial node which is firing the electrical impulses at much a faster rate. So viewers, starting with, so what are the causes of sinus tachycardia after heart surgery can be very well remembered if we just remember the mnemonic, what is called as combative. COMBATIVE. So the word combative is basically is going to refer, every alphabet of combative is referring to one of the causes of sinus tachycardia. So starting with, so actually the words C of the combative, it refers to the cardiogenic shock. So if it is a condition of cardiogenic shock, in such a situation, also the sinus tachycardia is seen. Apart from this, if oxygenation of the heart is poor, so in such a situation, it is seen that sinus tachycardia can be present in the patient after heart surgery. Apart from this, moving on to the next alphabet, that is M. So this M is referring to malignant hyperthermia. So it is mostly seen that after a cardiac surgery, there is can be some patients may exhibit extreme rise in temperature, in their body temperature. So in situation of malignant hyperthermia also, the sinus tachycardia can occur. In cases of the B of the combat is referring to bleeding. So in cases of, if it is a bleeding happening somewhere, so that can also be a cause for sinus tachycardia. So COMB we have covered. The A of the combative is referring to anemia. So in conditions of anemia also, the sinus tachycardia, that is an increased heart rate, can be seen. The A is referring to temperature and elevated. The I is that the inotropic drugs. So after a cardiac surgery, certain inotropic drugs are also administered. So because of them, this sinus tachycardia can happen. And the V of the combative is referring to the volume deficit. So in conditions in such a situation, so sinus tachycardia, if the volume deficit is there, so the heart is unable to pump a definite volume, the deficiency of volume is there. So in such a situation also, this sinus tachycardia can happen. And last but not the least, that is combative. The last alphabet, that is E, is referring to emotions and pain. So in the simple mnemonic, you can very easily remember the causes of sinus tachycardia after heart surgery can be very easily remembered if we just remember the word combative. That is COMBATIVE. So every alphabet of the combative is referring to one of the causes of sinus tachycardia after heart surgery. So students and viewers, this was a very short discussion about the mnemonics to very easily memorize for the professional exams the causes of sinus tachycardia after heart surgery. So students and viewers, if you still have any queries or comments, you are most welcome to comment me in the comment section. If there are certain topics what you want that I should discuss it for you in Hindi or in English, you are most welcome to comment me in the comment section. I'll be certainly taking up those topics on your request. So students and viewers who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.